personally would like Taylor Morgan to come up here and give a prayer.
Let us pray. Dear Lord, we just ask for your presence to be with us in this difficult time. We ask that you be with our patients who are coping with COVID-19 and with their families. This is a scary time for them. May they know of your comfort upon them and of your presence. And Lord, we ask that you be with our physicians, be with our nurses, be with all of our medical staff that are working with these patients at this time. May they know of your comfort and of your strength because they need it. And just continue to be with our leaders. I know this is a stressful time for them as well, making decisions, important decisions on behalf of Infirmary Health. May they know that you're walking with them and give them strength as well. Amen.
Good morning, everyone. I'm Mark Nix, President and CEO of Infirmary Health System. Thank you all for coming on such short notice. Taylor, thank you for the prayer. We all need it. A lot of people in our community need it. And the reason we're here today is to not only to create some awareness about the current situation we're in, which is at a crisis level in our communities right now, but all along the Gulf Coast in particular, but also to thank our healthcare workers, not only our healthcare workers across our city, of all organizations, but across our state and across our nation. But in particular, I want to thank the healthcare team here, the Infirmary Health team, for what they have done, because today we are at the third time since the pandemic's has occurred and been declared that Infirmary Health System is the leading caregiver across the state of Alabama for the number of inpatient COVID patients. This happened in July of last year when we first saw the wave of the pandemic come along the I-10 corridor from New Orleans. It happened again in January when we had a crisis with a number of deaths of our elderly and our nursing home patients, and it's happening again today as Infirmary Health now has over 300, and we have had for a couple of days, over 300 inpatient COVID patients in our 3 acute care hospitals. Now, Mobile Infirmary has been the leader in care across the nation. A couple of times UAB or Huntsville have treated more people, but we probably have more experience because our physicians have seen more, our team members have seen more, but that's starting to put a stress on our team members and our physicians. And we need your prayers for them, and we need your recognition for them. When we first had this crisis came out, there was a lot of support for our team members, a lot of support for our physicians and our nurses and all of our caregivers. And people were doing, vigils in the parking lot and prayer vigils and food recognition and gifts to our employees. The third wave around, everybody has COVID fatigue, and they are no exception. They have COVID fatigue as well. And it's time for us to start thinking about them again, recognizing them, and understanding the stress that they're under. Today, we have over 160 employees of our own team members that are out with COVID. We have over 650 open positions because the number of people that have retired or they've gotten fatigued of working COVID or working 12-hour shifts, taking care of other people in our community. So today, of all of those people that are in the hospital, the vast majority of them are unvaccinated. So this is also not only awareness, but it is an appeal to those of you that have not been vaccinated to please reconsider it, because it is not just about you and your families and your employees. The stress on the healthcare system today is starting to limit our capability of doing other things that we were doing before the pandemic was declared. The EMS response times are slower because there is very, very difficult to get patients in the hospitals, and we're going to hear from our hospital presidents. So please consider the vaccination. Please do us a favor and thank a healthcare worker, thank a physician for all that they're doing to try to save our community's health and get us beyond this pandemic so that we can move forward. So now I'd like to introduce Susan Boudreau. Susan is the president of Mobile Infirmary, and she's going to give you a little update on specifics at the hospital itself. And later on, we're going to take questions at the end of the announcements.
Good morning, everyone. Thanks so much for taking the time to be here and help us get our message out to the community because it's so very much needed. I mentioned just a minute ago to the mayor that I remember being in this very same spot in early December, and that's when our vaccinations hit. And we're at that point, the emotion in December is very different than it is today. In December, we were thrilled because it was the first time that we had something to help our patients fight this terrible, terrible disease. And so we thought it was like manna from heaven. Finally, we have some help that's arrived to help our community. Well, today, we're in worse shape than we've ever been. We are suffering our fourth surge of COVID inpatients at our hospital at Mobile Infirmary. We carry on average around 500 patients every day at the hospital. Mobile Infirmary is the largest non-governmental hospital in the state. As Mark mentioned, we've been leaders in the state during this entire pandemic because we have a lot of capacity and we have a lot of people and we're here to serve our community, and that's what we do, and we're happy to do it. So just to give you an idea of how it's impacted our hospital so quickly, on July the 1st, we had 8 COVID inpatients in our hospital, and none of those patients were on ventilators. Today, which is about 6 weeks later, we have 202 COVID inpatients. About 25 of those are on ventilators, and more than that, probably about 30 are on either high-flow oxygen or BiPAP. And that's really the next step. The next step is you get on a ventilator if you don't get better during that phase. And so we have seen a tremendous surge. It has overwhelmed our staff, our physicians, and really those, we've talked about heroes, and they were recognized as heroes early in the days, but y'all, they're still here and fighting, and it's hard on them. They see people suffering and dying. We had a 23-year-old patient die this week in our hospital, unvaccinated. It's tragic, and we just don't feel like the world understands what's really happening behind our walls in the hospital. I would say that I'm vaccinated. I'm happy to be vaccinated. Got it as soon as my age group and my opportunity came open. My entire family is vaccinated. I encourage everyone I know to get vaccinated. We know it works because we know that 80 to 90% of the patients in our hospital are unvaccinated. So that tells you in and of itself that vaccinations work. And we know that masking works. We've been wearing masks at Mobile Infirmary and through all our hospitals since March of 2020 because masking works. Our employees haven't been sickened by COVID patients in the hospital. When they've gotten sick with COVID, it's because they've been out in the community and maybe not masking like they should be. But we know we have our own little experiment within the hospital, and so we know vaccinations work, and we know that masking works. Unfortunately, we're having to close some of our services that we normally offer to the community. They're important for our community. Like our geriatric psych program, we have to move those nurses to the COVID unit. We're suffering staffing shortages. We've had to postpone our inpatient elective surgeries. People need surgery, and we want to be here for our community. But we just don't have the resources to take care of 200 COVID inpatients, and then, the balance of the rest of the patients still need help. And our ERs are full of patients that need help, not just with COVID, but for heart attacks and strokes and accidents and all the things that happen to people that bring them to the hospital. Very much appreciate you being here. I'll reiterate what Mark said. Please pray for our staff and our physicians. They have been the leaders in this pandemic since March of 2020, and they really deserve all the recognition and all the prayers you could give. Thank you.
Good morning. My name is Ben Hansert, and I'm the president for North Baldwin Infirmary. And like Susan Boudreau at Mobile Infirmary, we have also had a drastic change in our census at North Baldwin over the past 6 weeks. North Baldwin Infirmary is more of a community hospital. So we only operate 58 beds in our community hospital there in Bay Minette. And we generally run an average census of about 20 to 24 patients at a time. Well, now we're running at about 50 patients, average census on each day. We have 25 med-surg beds, and all of them are full. Majority of them are for COVID patients. Our ICU, we have a 5-bed ICU. They're all full. Every patient in our ICU is on a ventilator. Our emergency department, we have 15 bays. Out of those 15 bays, this past weekend, 11 of them were housing patients with COVID. This puts a tremendous stress on our hospital and our staff, especially for a hospital our size that wants to serve our community and our surrounding areas. People have asked, well, are you doing elective surgeries? No, not now, because we're having to use the space to house patients. And so when they look to see that we have beds available maybe in one area or another, well, can't we do outpatient surgeries? They don't have to stay in the hospital. Well, we would, but our nurses are being needed in other areas. Now our recovery room nurses are doing monoclonal antibody infusions. So it's taking all of our staff just basically to support the patients in our community with the COVID response. And they want to, and their heart and they're passionate, in their heart, they're very passionate about the care for their community. So right now we are currently 24 patients in our hospital that are COVID positive. So basically 50% of my hospital is positive for COVID, for inpatient. That's a big percentage for our size of a hospital. Out of those 24 patients that have COVID, 7 of them are ventilated. Out of those 7, all of them were unvaccinated. And for all of our COVID patients, approximately 90 to 92% are unvaccinated. So the vaccines work. I am personally vaccinated. My entire family is vaccinated. And we're glad to be a part of the process to get this whole COVID pandemic behind us. So as Susan Boudreau mentioned as well, please continue to pray for our staff. They are so passionate about the care they're giving. They want to be there. They don't want to go home, but they are tired. But none of them are giving up. And we appreciate them, and we thank our nurses, and we thank all of our physicians. And some of our physicians have even stepped up, and that usually do not work in the hospital, they just work in their offices. They have come in over the weekend to help provide care for our patients in our community in Bay Minette. So we thank all of our physicians as well for supporting us and helping us to get past this current spike in COVID cases in our hospital and our community. So thank you so much for being here today. We appreciate your time.
Good morning, everyone. Thank you for being here this morning. I want to start with just to reiterate what Mr. Nick said, and Susan and Ben. I think this part of this morning is really about our staff and our leadership and our physicians and what they're doing every day. When you walk the floors and you see the pain in their face and the anguish and the compassion they have for these patients, it's very, very touching, and they are giving it all every day. But the community needs to realize the significance of the pandemic we're in right now and the surge we're in right now. I will tell you, in January, I thought we could never exceed what we did last January. We went through that surge. We're running now about 70% above that. We are at 90 patients at Thomas Hospital this morning. We have a 164-bed hospital for med-surg, and we've got 90 COVID patients in there right now. 20 of those have been in the ER, rotating through the ER, trying to get beds for a week. I mean, we've kept 20 to 25 patients in our emergency department trying to manage, a number of those on vents, a number of those ICU. We have 14 patients on ventilators this morning. 98% of those are unvaccinated. 92% of our inpatients are unvaccinated. We have suspended elective cases at the hospital. So if you have an elective orthopedic case or a case you've been waiting for, those have been suspended. So our staff can rally together to support each other and care for these patients. And once again, our ERs are full. So if you're trying to provide access of care for anything outside COVID, it gets to be very, very challenging for our staff. So the message today is get vaccinated, protect yourself, protect your family. I'm vaccinated. My family's vaccinated. Took me a while to get my kids there, but they got there, and very proud of them for doing that. And it's about community responsibility, protecting ourselves and protecting each other. And let's continue to do that. And once again, thank you all for being here. And I want to recognize our staff, our team, and caregivers across this area deserve the recognition. So thank you all.
Yesterday afternoon, I had an opportunity to have a conversation with Mark Nix, and Mark explained the situational crisis that the infirmary and all of our healthcare providers are in the city of Mobile right now. So having understood where they are with the patient load, Mark was asking, he said, Mayor, what do you think that we can do as a community to make sure that all of our healthcare providers feel appreciated? So in a period of about 16 hours of thinking about that, I know there's a lot that can be done. And this morning in the staff meeting, we were kicking around things that we need to do as a community to make sure that we do the things that we can do. I want to regress just for a minute and say this, as citizens, we just expect if something's wrong with us, we're going to go to the doctor and be taken care of, or we're going to go to the hospital and be admitted, and there will be a physician or a nurse or somebody there to take care of you. And what you've heard today is that's not going to happen the way it's happened in the past. And unless we do something differently, it's going to just get worse. And so you have seen political leaders, you've seen sports figures, you've seen heroes and other endeavors tell people to please wear a mask, to get vaccinated. Well, we're in a pandemic crisis, but we're also in a crisis now with our healthcare workers, is the way I heard what these ladies and gentlemen have told us. So if you recall in the parking lot, the prayer vigils, the candlelight services, the things. Well, just in a matter of a few minutes of staff meeting this morning, what we realize is that we too, in city government, we have people that go underappreciated, and sometimes it's our policemen. But you know what happens when a policeman walks in a restaurant? There's somebody almost invariably that will buy their meal or go up and tell them thank you for their service. And I would challenge Mobilians, if you see somebody in scrubs or a white coat, or that you know that they are a healthcare provider and involved in that system, please go tell them thank you. Buy their meal, And if they're a personal friend, have you thought about because of the stress on it and because of the hours they're working, that maybe something as simple as cutting their grass. And that may sound corny to you, but it's not, because when you don't feel like you're appreciated, anything that somebody does for you is appreciated. Run the carpool for them. These are just a couple of the ideas that we had. I know that from the mayor's position that we're going to call for a day of prayer for all of our healthcare workers and for our community. That'll be forthcoming. But it's not just a day of prayer. I would suggest that we continue until we know that we have turned the curve on this, that we continue to pray for those who have to make a personal decision about wearing a mask, about getting vaccinated, but also for the healthcare providers. Because God's still in the business of answering prayers. So I would just say in conclusion, this is extremely stressful time for those who we're counting on to take care of us. And so please take this to heart. Wear your mask. And I know that one of the media is getting ready to ask me, well, Mayor, why don't you just make everybody wear a mask? Well, I cannot make everybody wear a mask, okay? I cannot do that. It's a personal decision whether you're going to do that. Now, I can tell everybody coming into one of the city-owned buildings that they have to wear a mask, and we're doing that, okay? So we're going to do the things, and we're going to continue to get the message out. But when it comes to vaccines, in the past, all we need to do was wash our hands and social distance and wear a mask. And today we know that that's less important probably than getting the vaccine. And so for those who have had a loved one in the hospital that did not think they were going to get it, and that were not vaccinated, we hope that you will help spread this word. And so I'm grateful that Mark reached out to me. Actually, we were following up this morning on another phone call, and he said, Mayor, we're going to have a 10 o'clock press conference this morning and tell everybody really where we are. And I actually said, Mark, I think I have some things I'd like to say to the community about supporting y'all. And again, I'm here at the infirmary, but it is all of our healthcare providers in every part of this community. So this I know is that when Mobilians understand that there's a crisis, a hurricane, and the aftermath of a hurricane, Mobilians will unite. And that's where we are right now today. We're in a healthcare crisis, and we need your help, and we need you to unite. So I encourage you to do that, and I thank you very much. Appreciate it.
Okay, let's go ahead and, if y'all have some questions? If y'all have any questions for our leaders that are here today? Okay, which leader?
I've got a question about the whole system.
Okay, okay.
Are employees in Infirmary Health required to get vaccinated, and if not, why?
Thank you. Let me respond to that. No, they are not required to do that now. We actually had an incentive-based program. We rewarded all of our employees that made the decision to help us and help keep everyone at work by giving a $100 incentive for everybody that was vaccinated. We gave out over $550,000 in the last week to those people that that came in and validated they give the vaccine. We will be reconsidering that. We're at about, I think the Alabama state average is somewhere around 37-38% vaccinated. We're over 65% vaccinated here among our employees. So we're well ahead of the curve, double what everyone else is doing. Part of that's through the incentive. When the emergency use authorization is lifted, which is fully expected to happen within the next 2 weeks, you're going to see employers and others start to mandate vaccinations. Some of that's already been announced by some healthcare workers, and we'll be considering that. Our plea is that with the number of people that are out and the number of employees realizing how stressful it is that we have 160 team members out, that they will make that decision for themselves and help us get our numbers up to where we can be another leader in the community in a different way. And I would say this one thing about the vaccines is, I know it's very political and I don't really understand everyone's politics about it, and it doesn't really matter. But if we looked at this disease, like if we looked at polio and smallpox, the way that people look at COVID-19, we'd be pushing around a lot of our children in wheelchairs, because we send them to school to get vaccinations for measles, for smallpox, for all the things that we've historically tried to eradicate from our planet and done a pretty good job with it. But for some reason, this one just doesn't hit home. But you look at the number of deaths, not only in our community, but across the state, the nation, and worldwide, it just doesn't make sense that people won't want to put political things in front of your own safety of your family and things. So I want you to consider that the vaccine, one day we're going to look back at this and say, what was this generation thinking? Why didn't they do what our forefathers did and eradicate polio and eradicate smallpox for developed countries? So.
I don't know who would want to take this, but you guys, all of the folks who spoke today painted a very grim picture about how you guys are dealing with this latest surge. If this continues, I mean, you guys are going to run out of beds, you guys are going to run out of staff to be able to handle patients. I mean, if that continues, could more people die if people don't take this more seriously?
Well, absolutely. The challenge is that and we were pretty full hospital and a healthcare system before COVID. And we've had to, we now have more employees out. We've had more employees retire. They don't like the working conditions, the stress of it. They're worried about their own safety. And this is a nursing shortage across the nation. This is a crisis. And it's not only that, but your response times, as I mentioned earlier, from EMS, they're sitting in our hospital bays and ERs with patients in them. We're having a hard time when we're converting 75% of our ER beds to holding patients. So when people start coming in for what they always came in for, whether it's an automobile accident, whether it's a cardiac event, or whether it's a neurological event or a stroke or whatever that is, our resources are now being strained, and at least half of those resources are being dedicated to something that roughly 85% of the people representing that 50% of care are unvaccinated. So we really need to stress this, is that it's not just COVID. It's every other service line. And now, as you've heard, just as they have in Huntsville and they have in Birmingham, we are suspending elective surgeries for at least a month to try to get our resources back together and take those caregivers and nurses out of those critical areas and put them in areas to take care of COVID patients. So yes, it has definitely has the risk of doing that. And this is not just us, and we're here to thank healthcare workers across our community and everywhere. But we were on a call yesterday with the Alabama Hospital Association and the Southwest Council of Hospitals. which includes pretty much hospitals all the way up to Washington County, Mobile, Baldwin County. Every single person is in this same position. And there was one hospital, a rural hospital up in Washington County, that the closest bed they could find for a patient that had a GI bleed but with COVID, they transferred that patient to Florida. And we're going to start seeing there is no capacity along the Gulf Coast. This is true. I talked to people in New Orleans, Ochsner is full. I talked to people at Singing River and Ocean Springs, they are full. I talked to people at Sacred Heart, they are full. So when we get full everywhere, there is no place to go. And we're going to be trying to find places that we can ship, patients to other areas outside of where they can be around their families. So it's a very detrimental time and a stressful time on all of our workers. Yes, sir.
There's been some reports in Mississippi about bringing in, contacting the federal government to come in and provide assistance, temporary medical facilities being set up, and whether it's parking lots or outside tents and stuff along those lines. How close are you moving, is this area close to moving in that direction? Is that under consideration?
Well, I think I speak on behalf of hospitals in Mobile because we've talked to all of them. We would prefer the resources be given to someone that has been treating this. We kind of know what we're doing now. We're 15 months into this. I'm afraid if we come up with a federal government and they place a tent in the parking lot, where are they going to get the resources that we can't get? Everyone in this nation, every hospital system is looking for nurses. Unless they have an inventory of nurses somewhere that we're unaware of, the most likely thing that's going to happen is they're going to be trying to get our nurses from our hospitals in our community and within our system to go work these emergency room tents. So we're supportive of help, but what we really need is some places other than inpatients, like the therapies that we're talking, the antibody therapies. You can give those in non-hospital settings. So we would love the assistance from the health department or from the feds to start doing these antibody therapies, which keep people from being hospitalized. If we can keep them out of hospital, I think we can handle it. So yes, we need resources, but I'm concerned about the level of care that you get when we start establishing tents in parking lots, and where do you get the employees? And again, I think talking to all the hospital systems in our area and nearby, they would prefer the resources be directed to us where we're already experienced in working on this.
Is Infirmary Health among the higher hospitals with COVID hospitalizations?
It's the highest in the state of Alabama right now. This is the third time it's happened. It happened in July, it happened in January, February, surge, and it's true again. I think UAB is somewhere around half the population the Mobile Infirmary has of COVID units. And we saw this before. The surge has typically started, the last 3 times, it has started along the Gulf Coast, and then it has moved inland. And so we've been talking to the governor's office, we've been talking to the state health officer. They're watching what happens here because of the crisis and the number of beds and personnel, but they're fully expecting this to happen in Birmingham and then on up into Huntsville. And it's going to happen that way across the state. As Susan said, we thought we were over the worst of it. We had North Baldwin and Thomas, I think, got down to actually either 0 or 1 or 2 patients in 8 here. And now we're higher at every location than we ever have been.
Urgent cares are busy, hospitals are busy. Where should people go to get tested? I mean, are you planning to open up any? I know it was always said from the beginning 15 months ago that, treatment's the same whether they need to go to whether they have to, or if they're severe enough, they have to go to the hospital, obviously, to get treatment. But are you guys planning to open any drive-through testing sites for folks so that they know that they are positive to stay out of the community? Right.
That's not the plan right now because of we may have to end up doing that, but we're so stressed on other resources. Testing is readily available. It's available across the community. Urgent cares, there's all kinds of places you can go get tested. But my challenge would be, what are you going to do if you go get tested? You can go get vaccinated and avoid getting COVID or have a high probability of it, or you can go get tested for it. And personally, I don't think that, and our healthcare professionals would tell you this, I'm not sure we can mask our way out of this. But we do know that vaccinations work. So we can't vaccinate our way out of this. But if you're wearing a mask and just hoping that you don't take it off at the wrong time around the wrong family member at the wrong dinner table and that you don't get it, the odds are you're going to get it. It is in our community and it's prevalent. And it's running about 40% of the people that are getting tested have COVID. So if you talk to 4 people or 10 people, 4 of those 10 people you're talking to in a conversation have COVID, whether they know it or not. And there's still some asymptomatic cases out there. So testing is not the answer. And we've been down that road and everything. Masking is a great answer for a little bit of time, but vaccination is the ultimate answer for us to get beyond this.
I want to ask about the employees. When
Yes.
they go into quarantine, do they have to use personal time?
No, well, we have a variety of things on that. No, we are actually allowing them, they have some earned time off that they have themselves. So we will use a couple of days of their earned time off to do that, and then they will go onto a workers' comp plan if they, because if they've contracted the virus while they're working with us, and we can identify where that was. We have a little bit of different situation that we have to deal with if they haven't been working here and they go off on a family reunion somewhere and they come back and they come into their system, then we have to look at that at a case-by-case basis. Where did they contract the disease? Was it through working with us, or was it personal choice or personal decision?
I asked because somebody said that majority of the employees contracted the virus outside the community, in the community.
I think that's true in most places because we're mandated masks. So I think that's probably true that most everybody did, and most everybody does, because if you come in a city building or you come into any hospital in this town, you're going to have a mask on.
Piggyback off what you said, we got at least one caller, but I think maybe 2, claiming that Mobile Infirmary has COVID positive staff working. Is that true? I mean, is that something that
That is not true.
that would not be true?
No. As soon as anyone finds out that we test someone, we send them home with a quarantine.
Okay, y'all.
Okay? Thank you all very much. We appreciate the attention to it. And please thank our healthcare workers when you see them. And thank the mayor for coming out and taking his time this morning as well. We appreciate your coverage.
Thank y'all so much. Thank you.
Before people who are infected with the Delta variant tend to spread this disease to at least 3 or 4 other people, maybe by some measurements, maybe 4 or 5 other people. That's more than twice as infectious as the original variant that we were seeing, and that's a real concern for us. We want to remind people of the importance of masking when you're in indoor public spaces. Even if you're vaccinated, we would recommend that you do that. Even though the vaccines are highly effective in preventing infection, there is a certain rate of breakthrough, and when people suffer those breakthrough infections, even though they don't tend to get very sick or to die, they can still spread the disease very effectively. So we are encouraging masking for anyone vaccinated or not in indoor public spaces, as well as our recommendation for universal masking in K-12 schools. I want to begin by going through a few numbers now, or follow up by going through a few numbers now. We are beginning to see some breakthrough cases, as you know. Unfortunately, this is another excuse that sometimes people give for not being vaccinated. They go, well, it's possible to get infected even if you get vaccinated, and that's absolutely true. That's true with all vaccines. However, this is still one of the most highly effective vaccines we know about. It protects probably more than 90% of cases, and certainly even with the Delta variant, more than 80% of cases, probably more than 85% of cases. We have seen since April 1st, when vaccines were widely available and most everyone had a choice to be vaccinated by that point, we've seen a total of 8,700 total breakthrough cases. So that actually represents, let's see, around 10% of the total cases that we've seen since that time. And that's about exactly what we would expect. We understand that there's going to be a certain number of breakthrough cases. However, the percent of fully vaccinated people who have died from COVID since vaccines were widely available in April is 0.001%. The chances of dying after you're vaccinated are extraordinarily uncommon. They have happened, and they tend to have happened in people who are older and have other chronic health problems that otherwise would put them at risk. It's not surprising that we have seen some deaths. but it is so much more likely to become sick, ill, hospitalized, or die if you are an unvaccinated person who gets infected with COVID. We want to remind people that we do have early treatment or even preventative therapy for people before they become particularly ill. We have monoclonal antibodies that are available around the state. We have several dozen locations where those can be obtained, most of those associated with hospitals. If you are a close contact and you're a high-risk person because of age or other medical problems, you may be a candidate to receive a monoclonal antibody treatment. It's an IV infusion or a subcutaneous injection. Your medical provider can help walk you through that. If you're someone who's at high risk because of your age or medical conditions and you are infected with COVID and you're mildly or moderately sick but not sick enough to be in the hospital, you are definitely a candidate for monoclonal antibodies, and we want to make sure that you have access to those. So please talk to your doctor about how to do that. For people who develop symptoms, we only have about a 10-day window for you to receive those antibiotics, so don't wait. Please talk to your provider about the possibility of doing that. I want to move on to a few other things. I want to remind people about our isolation and quarantine guidance. We still get a great deal of questions about that. I would say, in short, that guidance has not really changed much, except for people who are vaccinated. If you're someone who's infected with COVID, we want you to go home for a minimum of 10 days. 10 to 14 days is ideal. Please don't return to your public life until your symptoms are improving, until your fever has been gone for at least a day. That's the same recommendation we've had for a year and a half, and that has not changed. For people who are contacts to a case, if you remember our 6-15 rule, within 6 feet for 15 minutes exposed to an active case, again, our guidance has not changed in most cases. We want you to go home and quarantine for 10 days. There's some exceptions where you can quarantine a little bit less time than that, but we want you to go home and quarantine for at least 10 days to make sure you don't develop symptoms. There are a few exceptions to who needs to quarantine, or rather who doesn't need to quarantine. If you have had COVID in the last 90 days, then you're not counted as a close contact if you're exposed to someone else. Or if you're fully vaccinated, you're not counted as a close contact if you're exposed to somebody else. And finally, in the schoolroom setting, if you're at least 3 feet apart and everyone's wearing masks, you're not a close contact if you're exposed to a case. So those are the exceptions. Otherwise, our quarantine and isolation guidelines have not changed. We really need people to understand the importance of quarantining. If someone's exposed to an active case, particularly with the infectiousness of this Delta variant, there's a really good chance that they're going to become infected. So unless you meet one of these exclusion criteria, we need you to go home from the workplace, go home from school, go home from the social functions you normally participate in. Please stay at home for 10 days to make sure that you don't become ill. If you're a high-risk person, we would or even, I'll say not even for high-risk people, if you're a close contact, we would encourage you to consider getting tested 4 or 5 days after you've been exposed, just to see if you could have developed disease. In terms of vaccinations, we've seen an uptick over the past 3 weeks now. We're encouraged by that. We passed 18,000, I think, on this past Friday. Those numbers are still coming in, maybe still bump up a little bit. That's about 3 times what we were doing in June and early July. That's very encouraging. It's still far below where we were in April, in late March, early April, when we sometimes passed 40,000 or even 45,000 doses on a single day. But we are encouraged that people are continuing to get vaccinated. We have vaccines available in over 1,400 locations. Please remember that this is free. There is no charge. You will not be asked to pay for this. For people who have insurance, your provider may ask for information so they can bill an administration fee, but there is no charge for being vaccinated against COVID. We get that question a lot. It's a shame that people haven't quite heard that message, but many people still are worried that they'll have to pay for this in some way, and you will not have to pay for this at all. There is no charge for this vaccine. It's completely free. You can get this vaccine today in every county in Alabama in multiple locations without an appointment. In just about every case. Please check our website to see where those locations are, or vaccines.gov. You can put in your zip code and see all the places that are near you based on how far you want to travel, and even which vaccine product you want to get. Remember, Moderna and J&J are for people 18 and up. Pfizer is also available for 12 through 17, so you can search for which location has the product that you want to get. And you can get that today without waiting. We want to encourage people, again, to do it as quickly as possible. Our vaccine numbers need to be a lot higher than they are. If you get vaccinated today, you've got 3 or 4 weeks before you get your second shot in most cases, and then you're going to have a couple of more weeks before you're fully protected. So the actions that you start taking today are great, and yet we're not going to realize the full benefit of those for 6 or 7 weeks. And that's why it's so important to go do that now. Remember, we are just now seeing our deaths begin to climb. Our death numbers have not been in double digits for months, and yet over the past 8 or 9 days, except for weekends where we didn't have full reporting, we've seen deaths reported to us of 35 people in one day, 41 people, 23, 24, 26, 13, and 19. With a weekend where we only had 1 total just because of reporting concerns. But what I need you to remember is that deaths are a lagging indicator. Deaths happen last. We see case numbers go up, we see hospitalizations go up, and then we see deaths go up. So we've had more than a week now of deaths in double digits. This is a snapshot of what was happening 3 or 4 weeks ago, okay? The numbers you're seeing today in deaths are telling us what was happening in Alabama around the 4th of July, okay? It's not what's happening today. So there's no way that these numbers are not going to continue to increase because we're continuing to see these case numbers go up. So please be aware of that. Please do what you can to protect yourself, and please try to get vaccinated as soon as possible. I'll say I have just a couple of other things that we have questions on, and before we get to questions, I just want to remind people, if you've lost your vaccine card, that is something that can be replaced, although it might take a little bit of effort to do that. There certainly is a record of your vaccination if you received it in Alabama in our immunization database. Please contact the person who gave you the shot if you are able to do that. We do not have electronic copies of people's vaccination cards ourselves, so we would ask you to please start with your provider at this point. If that's not an option, then your county health department may be able to provide some other information for you. Ultimately, you can get that vaccine information, but it is a pretty manual process and doesn't happen quickly. So if you've lost your card, please start working on getting that replaced as soon as possible. Let's see. I think that's all the prepared comments I had right now, and I'll be glad to answer questions. We can start here in the room with questions. Yeah.
Dr. Harris, there's a lot of trepidation and concern with kids coming back to school. What do we know now about how the Delta variant affects children? A lot of people are taking comfort with the idea that original COVID wasn't as rough on children.
Yeah, so the question has to do with the Delta variant and its effect on children. There's a lot of anecdotal evidence. There's a lot of reports that kids are more severely affected. Clearly, kids are being infected in higher numbers. I don't think we're surprised by that because we have a much more infectious variant circulating, and we have older people who are relatively more protected since they are the ones who tend to be vaccinated. We've had, I think the number I saw yesterday was about 39 or 40 kids who were hospitalized around the state with confirmed COVID. There were another 10 or 12 that were suspected to have COVID and were awaiting confirmation. Those are definitely higher numbers than we have seen before. So I think the evidence points to the fact that it is affecting our kids more, whether that's because it's causing worse disease or whether it's just that there's a lot more cases from a more infectious variant. I'm not positive on that yet. I think, let me ask Karen Landers. Dr. Landers, who's a pediatrician and our health officer, is on the call. Karen, do you have anything to add about the Delta in kids?
Yes, Dr. Harris, thank you so much for asking me to comment. And I just want to reiterate what Dr. Harris has said, and that it appears, at least anecdotally, that we are starting to see more children that are ill from Delta. And again, something that we had not seen quite as much of with the original SARS-CoV-2. And I think another aspect of this is really something that our infectious disease doctors and pediatrics continue to remind, and that is that children who have SARS-CoV-2, who have COVID-19, can have residual symptoms. And at least up to 6% of children in one study have been shown to have long COVID. We absolutely must not discount the effects of this on children, in addition to being aware that we do have limited pediatric beds and pediatric ICU capability in the state of Alabama. Thank you.
Thank you. Okay. Anybody else?
Dr. Harris, when it comes to the Delta variant, we know that it's more transmissible, but for a person that would contract the Delta variant, are the symptoms more aggressive?
It doesn't appear that it's causing worse disease. There has been one study from Scotland that looked at the severity of the disease that suggests it may be a little worse, but probably overall it's not. Most people don't think it is more severe. It's certainly not less severe. You know, our rates of death that we're beginning to see now are looking like they're going to be just like we've seen before. I think we had all thought that if we have a younger population that's mostly getting infected now instead of an older population, that we wouldn't see, that it might seem to be less deadly overall. I'm not confident of that at this point. It is interesting that there seem to be some different kind of clinical presentations, a lot more of the gastrointestinal effects that we saw early on with the original strains. We don't see so much with Delta. It is more upper respiratory type stuff. So it is subtly a little different clinically, but not clear that it's worse. Definitely not clear that it's not, however. So.
Dr. Harris, how worried are you when with school, we've talked about this before, but with school back in session, universities back in session, even though a lot of colleges are requiring masks, what's your biggest fear in, say, the next 30 days as cases could pop up, and we see the lagging effects of that, especially among, say, 20s or younger?
Yeah, I think the biggest concern is that we're going to continue to have increases in our case numbers, and a certain percentage of those people are always going to end up in the hospital, and a certain percentage of those people are not going to survive. So just the sheer numbers are going to lead to more people being sick and more people dying. But this is an incredibly taxing event for our healthcare system. You know, we have, you know, requests to come through the Alabama Incident Management System all day long from hospitals. Those are going up like crazy, and they're not necessarily COVID related. They're places that don't have a location to put a trauma patient. They don't have a location to put a patient who suffered a heart attack. These are very taxing on our medical systems, and so young, healthy people who may not be worried about COVID may have to have their appendix out, or they may be involved in an automobile accident, and it's going to be really difficult to figure out how that care is going to be delivered. Now, our hospitals have done a great job of doing that so far. They went through January and somehow managed to get through that, but clearly it's just not something you can do forever.
One of the largest groups
Dr. Harris,
that's
multiple
hesitant about
hospitals.
I'm sorry, let me go to the phone and then we'll come back to the room. Go ahead.
Thanks. Multiple hospitals around the state, have mentioned in recent days that they're actually working with less staff than they had during the winter surge due to staff attrition, multiple reasons. We're seeing in Louisiana and Mississippi right now requests for federal aid to staff to help staff hospitals. Do you think that request might be likely from anywhere in Alabama in the next couple of weeks, or is that something that y'all have already requested?
Yeah, so we have not made a formal request. We have had multiple calls, and actually yesterday had a long visit with federal officials about the possibility of doing that. We're still working to figure out how those folks would be plugged in, how we would make a decision about where to use them. They come as sort of teams that are intact teams, and they're not just individual people you send here and there. So we're trying to figure out how that would work, but I do think that's a real possibility for us. Yeah.
One of the largest groups of the
Let me go to the room here, and then I'll go back to the phone, okay?
One of the largest groups to still not be vaccinated are those healthcare workers that are working in the hospitals, and some hospitals are talking about mandates to do that. What's the issue there? What do you feel like that is the issue there, and why the hesitancy in hospitals?
Yeah, I think overall our healthcare workers are not nearly as vaccinated as we would like, and yet they're a lot more highly vaccinated than the average Alabama population. And I do think it also kind of depends on, which hospital staff in particular you're talking about. I think our, critical care physicians and our ICU nurses, I think those folks are vaccinated in really high numbers. And, when you get to other jobs that are maybe less clinical jobs or maybe not directly dealing with that, the numbers are lower. Certainly our nursing homes, have done a great job of vaccinating residents, probably have not been able to reach their staff quite as easily. So, again, I think it just takes education, in terms of, mandating or not. My understanding as a non-legal person is that that's allowed in Alabama, that employers are able to do that. At least some employers are able to mandate that. But we wish, mandates weren't necessary. We wish people would just get vaccinated. Yeah, and we'll go to the phone now.
Dr. Harris, this is a question from our viewers.
Overwhelmed due to the high number of calls and need help from the state. They're hoping for a disaster declaration. Is that in the works?
Is that, I'm sorry, what was the last sentence? Is that
being discussed?
Oh, in the works, yeah. Yeah, I would say absolutely. I mean, ultimately, that's a decision that the governor, will have to make. We certainly are trying to provide all the available information on that. There, if a, disaster declaration is coming, there, certainly needs to be really clear benefits from doing that and reasons to do that. We're working through ourselves the ways in which that could be beneficial. I know the healthcare institutions, some of them have, written, maybe may request about that. I'm not sure about the status of those things, but at this point, we're still trying to work within the framework that we have now, and then we'll have to figure out what a disaster declaration could add.
I have a question, Dr. Harris.
Yeah.
You talked about the coronavirus vaccines being free, but with the resurgence of cases, what about testing? Are people still able to get free testing at some of these locations around the state?
Yeah, so testing is, by and large free, at least in many locations, I guess, depending on where you go. But county health departments have reworked their staff to come up with routine testing teams as well. Many of our testing teams have shifted to vaccination efforts, but we have gone back to make sure that we have adequate testing as well. We have worked with I think that we may have closed the contract yesterday or maybe it'll be today, but we're working with a private provider who's going to do testing that we're going to set up in Mobile County, in Baldwin County, and then perhaps soon in Mobile County as well, that will just do testing as a way to try to take the burden off the healthcare facilities down there so that people aren't going to the emergency room. That'll be at no charge to people as well. So most testing is done free, although that may not be true, depending on which provider you go to, but certainly it is for us in public health.
Dr. Harris, this is a question we got from one of our viewers. How can they find out the number of new COVID patients in hospitals that normally wear masks and the number who do not wear masks on a regular basis, and how many of these are children of school age?
Alan, I don't think there's any way to know that. Usually those, I don't know about what that question is really getting at, but usually there are people who, want us to prove mathematically that masks are preventing cases. I don't think there's any way to consistently know exactly who wears what for how long and come up with an answer on that. We are getting pediatric information on hospitalizations. We can certainly tell you the numbers, but we don't have the ability to, to link an individual case to who's wearing a mask or, who in their home is or isn't or where else they've been. I don't know of a way to do that. The recommendation on mask is a consensus recommendation from the people who study respiratory diseases and the people who understand how these types of things are transmitted. You know, we're never going to be in a position where you can go do a case control study and give half the people masks and refuse to let the other half the people wear masks and see who gets infected. I mean, that you can't do human experimentation like that. Ultimately, you know, the people who know the most about viral diseases and how they're transmitted say this is a reasonable way to prevent people from getting infected, and I agree with that wholeheartedly. Yeah, we'll go ahead.
My question, dealing with schools, Birmingham started a week or so ago. 31 kids, we understand, have come down with COVID, 3 staff members. Are you seeing now that infection rate going up right now because schools returning?
I would say that makes sense, although I can't say that for certain. I don't have the full breadth of the data to say that. The schools are going to be reporting to us again, just like they did last year, the cases that occur in their district. That'll be part of the school dashboard that, you know, it's still on our dashboard, although it hasn't been active since the end of the school session in the spring. But we'll have that up in the next 2 or 3 weeks, or it may get pushed a little bit longer. It may be into September, but we're going to have that up again as soon as we're able to get the schools back up and running and in session, and then they're able to report that data, and then we'll get it displayed for the public. But I think we'll be able to answer that question once we start getting better reports to it. So, yeah.
Dr. Harris, health officials in Mobile County say that we are in a crisis mode. Some critical patients are being flown out of state because we don't have enough beds. Can you talk about how serious this is?
Yeah, I agree. It's incredibly serious. We are seeing, you know, many requests from hospitals to transport patients who have nothing to do with COVID just because there's just no capacity. We know that, you know, a number of facilities have reached out to us about certain types of waivers of rules that allow them to, you know, put patients in other parts of the building and places they wouldn't normally provide, you know, medical care, and there's a mechanism in place so they can do those sorts of things. But clearly we're going to be taxing our, you know, hospital capacity in a way that we haven't seen before. I think we're very likely to pass our maximum number of hospitalized patients in the next 3 or 4 days, certainly if the numbers keep going like they are. Go ahead.
As you said, our numbers are approaching where we were in January, but at that time we had state mitigation orders in place, mask closures, et cetera, which no one liked. Without those in place, is it possible that this wave is going to be worse in numbers of hospitalizations?
Yeah, you know, I don't know if it's going to be worse. It looks like the numbers are on a trajectory to be higher. I think we feel better about the fact that, you know, our most vulnerable people are mostly vaccinated, and that really helps a lot. It means they're much less likely to get sick or to end up in the hospital. Our hospitals, you know, as taxed as they have been, you know, again, have had a few more months to get better experience at treating the disease, but also to, you know, make sure their logistics are in place and all their material is you know, stocked the way they want to do it. So there's some things that make the situation a lot different now. But, you know, the other factor is we have a much more transmissible variant. I mean, it's much easier to spread. So I would, you know, I don't know what's going to be worse or better or whatever, but we're going to have a few more tough weeks.
Dr. Harris, this far into the pandemic, what do we know about the best treatments for people that test positive, go home and quarantine? What do they need to do to keep from getting so sick they have to go to the hospital? What are the best treatments?
They need to get monoclonal antibodies in most cases. So monoclonal antibodies are infusions that have been available now for, you know, almost a year. There are different brands of them. There are, you know, a couple that have been we paused using because of concerns about resistance of the variants, but we also have other ones, new ones now that are available as well. They're widely available in dozens of places across the state. They're mostly given as an IV infusion, although there's some situations in which you can give them as a injection under the skin, a subcutaneous injection. They are, in most cases, for people who are at high risk for getting really sick. So people who are older, people that have chronic health problems, people who are not yet in the hospital. They're not for use for people who are already in the hospital. And you need to use them as early as you can. We try to make sure we get people to an infusion center within 10 days of developing symptoms, but the earlier the better. And, you know, sometimes it takes a day or two for a sick person to go get a test and then get their result, and then we have to find an infusion center for them, and that might take a couple of days. So, it's not infrequent that we're bumping up against that 10-day window, but that is the answer. That's what people need to do.
One more final question from me, Dr. Harris. President and CEO of Infirmary Health this morning in a press conference said that we can expect the FDA to fully approve the vaccine within the next couple of weeks. Have you heard that?
I think I've heard the same, maybe the same media reports that person was referring to. I didn't hear that statement in Mobile, but yeah, we have heard that. Just in the national media, I don't have any inside information beyond the stories I've heard in the national media. We do know that CDC is releasing recommendations now about booster doses for immunocompromised people. We can talk more about that as well. But in terms of full FDA approval, I think we feel like the next 2 or 3 weeks we'll know the timetable for Pfizer. It'll be just for the Pfizer product. The others are a little bit behind the timetable there. Yeah.
Is the dashboard giving cases in schools, is that going to be updated, and if so, when and how often?
Yeah, that's what I was referring to earlier. So it is going to be updated. That, if you remember, just relies on voluntary reporting by schools themselves, and so we have asked them to start giving us that information again. They're very willing to do that, but schools, of course, are just now starting. And so it's going to be at least 2 or 3 weeks, or maybe into September sometime before we're going to have that up and running. But yes, it'll be the same dashboard that we had last year that has been paused really since the end of the semester last year.
Dr. Harris, you mentioned about the booster shot. Are people in Alabama trying to get that booster shot now? Has any gotten it hook or crook, and do you see the benefit of that?
Yeah, I don't actually know if anybody's gotten it. We're not exactly policing it. Our recommendation, we have not made a recommendation for people to do that yet because we've been waiting on guidance on that. So it wouldn't surprise me if somebody hadn't managed to get that. We certainly have adequate supply. I don't think it's a issue of fairness anymore. It's not like there's not enough to go around. We certainly have plenty to go around, but really our recommendations are based on what we get from national public health authorities and also from the FDA. It's not appropriate for us to make an off-label recommendation on an emergency authorized product without the proper guidance to support that. So as soon as we get guidance on that, we're gonna release that ourselves.
You may have touched on this, but any update on the number of vaccinated people that are hospitalized, or the percentage of the hospitalized patients that are vaccinated?
Yes, I do have that. Let's see. We were working with the Alabama Hospital Association to collect that information. We have been getting about 5, I think we've been getting it regularly for about 5 days now, and so we'll start sort of prominently displaying that information as soon as we're confident in what we're collecting. But for the past 5 days, about 88 to 89% of people have been people who aren't fully vaccinated. So around 11%, on a couple of days, 12% of people who were fully vaccinated have been hospitalized. So that's pretty much in keeping with what we would see. We're actually past 1.6 million people who are fully vaccinated now. More than 2.1 million people who are at least partially vaccinated. So that's pretty consistent with what we would expect. The vaccines significantly reduce your risk of being hospitalized and almost totally eliminate your risk of dying. And so we need people to be vaccinated.
Dr. Harris, do you expect that we're going to go over 3,000 in the next 4 to 5 days? That was basically called a crisis situation last year. Is the entire state, every hospital in Alabama is going to be in a crisis situation as soon as next week? And how bad does it go, 4,000 or 5,000 patients?
Yeah, I don't know, of course, but certainly the trends right now are not very encouraging. The numbers are still continuing to accelerate. we, if you just map out the slope of the line, we will be at 3,000 people in the next, 4 days or so. I hope that doesn't happen, but it certainly may. Again, like we mentioned earlier, there's some ways in which we're in a better situation now than we were in January. But there still is also, some absolute number, I don't know what it is, that we just, can't go beyond because we just logistically can't handle it. So I think the message we want people to take away is that most of these hospitalizations, 90% of them are preventable. Please go get vaccinated as soon as you can so that you don't end up like one of these unfortunate folks who's had to be hospitalized or worse. Yeah. Oh, sorry.
Just picking one that, just to clarify, that 88 to 89%, are we talking about people who are fully vaccinated or have at least one shot?
So let me give you, so the number, so I have it on my phone. I'm sorry, I'm pulling my phone out here. Let's see. Over the past few days, this is on average over about 5 days, about 11% are people who are fully vaccinated, about 3% are partially vaccinated, and about 86% are completely unvaccinated. Okay. Anybody have any other questions?
Dr. Harris, that number that you said earlier, the 0.001% of, is that people that are vaccinated, like all the people that are vaccinated that have died from COVID, or is this people that are vaccinated and have had COVID, have had positive cases that are dying from COVID?
So that number, what we're calculating is we went back to April just because, that's when we had vaccines more or less widely available, and obviously it didn't make sense to, go back to a year and a half ago and talk about vaccinated versus unvaccinated. So going back to April, we've had a total of 23 deaths that have occurred in breakthrough people who are breakthroughs, and the denominator is just the number of people who've been fully vaccinated since that time, and I didn't write down what the denominator was, but it's 0.001% of the people who've been fully vaccinated since then who have died, and that number is a infinite. Is a tiny number.
And one more question. I know that there have been, there are now COVID tests on the market at local pharmacies, Walgreens, and CVS. Do you recommend people getting those tests that maybe don't have time to go to the doctor that think they might have it?
Sure, absolutely. I mean, if you're not able to get tested in any other way, we certainly would recommend that. We still hope people are interacting with the healthcare system. Those home tests are things we don't have visibility on. We don't necessarily know if people test positive, and as long as people have good medical advice and know what to do, I guess that's okay. But obviously, we like to be able to track the number of people who are infected if we can. And again, if you have a physician or other healthcare provider you're working with, you can get advice on what to do if you turn positive. Where do you get monoclonal antibodies, or what other care might you need? So I certainly wouldn't discourage people from doing those. It's probably better if you interact with your healthcare provider to get tested, but if this is the the best way you have to do it, then certainly that's good too. Okay.
Dr. Harris.
Yeah.
You spoke earlier about the importance of making sure that people hold on to their vaccination records, their card, or to replace it if they were to misplace it or lose it. Why is it so important that folks hold on to these?
Well, there's a whole lot of, there's a big national debate, or international for that matter, about, health records that, the government mandates that people use or enroll in or carry or so on. And, we're not going to settle that in this room, but by and large, these cards are, sort of in different systems from state to state, depending on what the immunization information system is for a given state. And, we report these numbers to the feds, but they don't have a database that would really allow them to track it in the way that, you might somebody tracks your income tax. So it's a fragmented system. It is mostly a paper system. Most people don't have the ability to get electronic copies of their results in most cases. And so it's just, it's a challenge to keep up with a piece of paper. If you have to keep up with your Social Security card or even keeping up with your driver's license, you just have to keep those things safe, because it's not that they're irreplaceable, but it's problematic to get them replaced when you're talking about a physical document. So we do want people to try to hang on to those, make a copy, keep it somewhere safe. Some people ask about laminating them. I would just say, if you want to, but there may be booster doses coming for some people, and you want to still be able to add that to your card if you can. So maybe think about laminating your copy instead of your actual card. And if you do lose your card, please reach out to your provider to start working on getting a replacement.
Dr. Harris, have the guidelines for getting tested changed since the Delta variant, since there are so many people who have been vaccinated and don't show as serious symptoms?
Just a little bit. By and large, they have not changed, except that even though we don't classify a close contact as in someone who's been vaccinated, if you're exposed to a case and you're vaccinated, we don't consider you to be a close contact. But we do recommend that you get tested about 4 or 5 days later, just in case you could have become infected. Vaccinated people, don't have a serious disease, so they may not really come to medical attention. They may not feel sick, and yet there's still the possibility that they could get infected. I would tell you that we know about a few thousand. I mentioned breakthrough cases so far. We've actually fully vaccinated 1.6 million people. So just statistically speaking, there could easily be 300,000 breakthrough cases out there, and we've not even, we don't even know about a fraction of that. So it's certainly possible that if you're fully vaccinated, you could be asymptomatic but still infected. All right. Any more questions? All right. Well, thank you guys for your time. We'll be glad to do this as long as you guys find it helpful, and we'll talk to you soon.